Hello friends, I am Professor Smita Jha from the Department of Humanities and Social Sciences, and I am doing Health Humanities in Disability. And under this caption, today we are going to discuss role of humanities in medicine, because the entire course is based on the humanities collaboration with medical science. So the humanities in medicine, often termed medical humanities, bridge the gap between highly technical scientific treatment and the lived human experience of illness. By integrating disciplines such as literature, visual art, history, and philosophy, medical humanities transform doctors from medical technicians into holistic healers who can navigate the complexities of patient care. Now, what are the key roles of humanities in medicine? There are several roles that humanities play in the medical field, and some of these include first is cultivating empathy and compassion. Medical humanities help physicians understand patients' experiences, perspectives, and suffering, moving beyond reductionistic views of illness. Second is enhancing clinical skills. Training in literature and narrative medicine aids in understanding patient stories, while the visual arts improve diagnostic observation skills. Third is addressing burnout and professionalism by promoting self reflection and self care. Humanities help physicians manage the emotional toll of clinical work and uphold ethical standards. Fourth is understanding social context, that is, anthropology and sociology provide insight into social determinants of health, cultural differences, and inequities in healthcare. Fifth is developing critical thinking, that is, philosophy, particularly bioethics, helps medical professionals navigate complex moral, ethical, and end of life decisions. What is the impact on medical education if we talk of role of humanities? So humanity has a deep impact on medical education. Some of the ways these impacts become visible are: first is curriculum integration. Medical schools are integrating arts and humanities to develop well-rounded, empathetic doctors, with studies showing positive student feedback and increased empathy scores. Second is complementing science. Humanities work alongside biomedical knowledge, offering a balanced perspective that helps trainees navigate the emotional and social aspects of patient care. Third is preparing for future challenges. Humanities prepare doctors for complex, ambiguous, or unpredictable situations such as pandemics and working with diverse populations. Now, what are the core benefits to medical practice? First is enhanced empathy and compassion. Engaging with literature and patient narrative allows clinicians to walk in another's shoes, fostering a deeper understanding of suffering, vulnerability, and personal context. Second is improved diagnostic observation, that is, training in visual arts such as analyzing paintings or sculptures has been shown to sharpen pattern recognition and improve the detail and accuracy of physical diagnostic reporting. Third is tolerance for ambiguity. Unlike science, which often seeks a single correct answer, the humanities thrive in murky gray areas. This prepares clinicians to manage uncertainty and nuance in complex medical crises. Fourth is burnout prevention and resilience. Exposure to the humanities provides a zone of creative relaxation and a healthy emotional outlet for the stress of clinical work. Physicians with higher empathy levels are significantly less likely to experience burnt out. Fifth is effective communication. Studies show that humanities performance is a strong predictor of success in medical internships, as it enhances the ability to listen, interpret non-verbal cues, and explain complex information clearly to patient. If we talk of the art of medicine versus the science of medicine, we may say that while scientific knowledge pathophysiology, and pharmacology is foundational, it is often insufficient on its own. The humanities ensure that patients are seen as whole persons, not just a collection of organs or a list of problems to be solved. Second is socio-cultural context of health, that is race, religion, family dynamics are recognized as critical factors in ethical decision making and treatment compliance. Third is professional identity is formed through self-reflection and a developed professional conscience rather than rote memorization alone. Medical humanities enhance empathy and compassion in healthcare by utilizing arts, literature, and narrative to cultivate deeper patient understanding, ethical sensitivity, and resilience. A structured program such as creative writing, art observation, and reflective practice help clinicians move beyond purely technical skills to address the psychosocial dimension of illness. The key impact of medical humanities on care, in a way, medical humanities have consistently had a significant positive impact on caregiving and understanding of healthcare. Both care providers and patients, as well as lay people, gain important insights and deeper awareness. Now, some of these impacts include enhanced empathy. A study suggests that literature, narrative medicine, and art appreciation encourages students to see the world from another person's perspective, improving their ability to connect with patients' emotion, intention, and experiences. Then comes cultivating compassions. By focusing on the human experience of illness, including suffering, aging, and death, humanities training helps transition from cognitive understanding of pain to compassionate action aimed at alleviating that suffering. Reflecting practice, engaging with creative mediums encourages self reflection, which helps students manage emotional ambiguity and reduce the risk of burnout. Then comes improved communication. Humanities courses often highlight the importance of narratives in medicine, leading to better patient communication and the ability to interpret nonverbal cues or implicit patient concern. Now, let us discuss methods used to improve compassion. Medical humanities encourage several methods to improve compassion in individuals. Some of these methods include narrative medicine, and this include analyzing stories and patients' narratives to better understand the subjective experience of disease. Then visual arts and music, and this includes using art and observation to enhance listening skills and attention to detail, and using music to develop emotional awareness. Theater and role play. This includes utilizing methods like the theater of the oppressed to explore patient vulnerability and power dynamics. Reflective writing. This includes encouraging students to reflect on their own clinical experiences to identify their own biases and feelings. Let us talk of efficacy and implementation factors. Intervention duration. Short-term program under 4 months show the most immediate gains in empathy. Longitudinal integration is recommended to combat empathic erosion, a natural decline often seen as students progress through medical training. Gender differences. A study suggests these programs may benefit female students more than males, as women may be more receptive to emotional signs and respond quicker to humanistic intervention. AI integration. As artificial intelligence transforms clinical practice, the humanities are viewed as vital for ensuring that empathy remains central and that technology complements rather than replaces compassionate care. If we talk of benefits of enhanced empathy and compassion, first come patient outcomes, correlates with better chronic disease management, reduced symptom severity, and higher patient satisfaction. Then comes clinician well-being. High levels of cognitive empathy, that is understanding, can reduce burnout, whereas unchecked affective empathy, feeling the patient pain, may increase emotional strain if not properly regulated. Third is bias mitigation. Humanities coursework combined with service learning helps students identify and reconcile implicit biases towards marginalized groups. Medical humanities intervention typically range from single session of 2 to 6 hours to longitudinal programs lasting up to 1 year. Research suggests that shorter interventions, particularly those under 4 months, often show the most significant immediate impact on competencies like empathy. Common intervention duration, which talks about programs which are structured in several ways depending on the educational or clinical goal. The first is single session or short term, often consisting of workshops or intensive seminars lasting between 2 to 6 hours. Some specific interventions like visual art workshops for medical interns may be as brief as 3 hours. Medium term, 4 weeks to 4 months. Many structured curricula for medical students or residents follow a semester based or rotation based format. Studies have found that interventions in this range, up to 4 months, have a tremendous benefit in enhancing empathy. Long term, that is 4 month to 1 year program integrated into medical school years or year long residency tracks. Interestingly, meta analysis have shown that while benefits remain for programs up to 12 months, interventions exceeding 1 year sometimes show a plateau or no additional effect on measurable empathy scores. If we talk of factors influencing effectiveness, then first come frequency. For narrative medicine specifically, participants often find a frequency of every 4 to 6 weeks to be ideal for maintaining engagement without causing burnt out. Modality, combining courses with reflective writing or clinical practice is often more effective than lecture only formats, regardless of the overall duration. Sustainability. While short intervention provide high immediate returns, longitudinal tracks spanning multiple years of medical school are often used to ensure the humanistic perspective is reinforced throughout clinical training, though their statistical impact may be harder to isolate in short-term studies. Medical humanities program effectively enhance empathy and compassion in healthcare professional and student, with meta-analysis showing significant improvements in empathy scores following intervention. These humanistic dimensions are considered essentially for patient-centered care, building trust and improving clinical outcomes. Gender differences in health are shaped by a complex health survival paradox. Women typically live longer than men but spend a greater portion of those years in poor health or with disability. This disparity stems from a combination of biological factors and sociocultural influences, that is gender, that affect disease risk, symptoms, and how individuals interact with healthcare symptoms. To elaborate on this health survival paradox, there are several more factors that contribute to women being more biologically resilient and yet suffering from more medical problems. And these are: first is longevity versus morbidity. Globally, women have a longer life expectancy, averaging about 5 years more than men, partly due to biological advantages like the protective effects of estrogen on cardiovascular health before menopause. Second is disability burden. Despite longer lives, women experience higher rates of non fatal but debilitating conditions. Conditions like low back pain, depressive disorders, and headache disorders are significantly more prevalent in women. Male mortality. Men face a higher risk of premature death, largely driven by ischemic heart disease, road injuries, and lung cancer. If we talk about biological differences, first come genetics. Women have two X chromosomes, which can provide a backup for certain genetic mutations. Men with only one X chromosome are more susceptible to X linked disorders like hemophilia and color blindness. Then comes immune system. Women generally mount a stronger immune responses, which helps fight infection like COVID-19 more effectively, but also makes them roughly 80% more likely to develop autoimmune diseases such as lupus or rheumatoid arthritis. Cardiovascular health. Heart disease symptoms often differ. Men typically report classic chest pain, while women may experience atypical symptoms like nausea, jaw pain, or extreme fatigue, often leading to underdiagnosis. If we talk of socio-cultural gender influences, first come behavioral risk. Men are statistically more likely to engage in health-harming behaviors, including smoking, heavy drinking, and risky driving. Then comes healthcare seeking. Societal expectations of stoicism often deter men from seeking preventive care, leading to later diagnosis. Conversely, women utilize healthcare services more frequently but often face pain dismissal where their physical symptoms are misattributed to mental health issue. Research bias. Historically, medical research has centered on male physiology. This has created a data gap resulting in medical guidelines and drug dosages that may be less effective or cause more side effects for women. That is all for this lecture. In the next one, we will continue to look at gender biases in the field of medicine and how medical humanities sheds light on these along with offering ways to equalize the differential treatment received by men and women. Till then, thank you. Let us meet in the next lecture.